As you know, we have a big transplant program and we have a huge database. And one of my colleagues and very smart fellow, Oren Paswalski, was interested in the project that is there any impact of sex or gender on the outcomes? People have looked at this in smaller studies, but we looked at our data set and more than 2,700 patients. Again, majority were males, and we basically looked at if there was any difference in terms of response rate and survival outcomes, progression-free survival. And when we looked at the group as a whole, of course, these were reasonably well matched in that analysis. But and our primary endpoint that we thought we would look at would be the progression-free survival and also look at overall survival. And we could not detect any difference in median progression-free survival. Of course, most of those patients received the induction regimen, which are given to our myeloma patients. Most of them received high-dose melphalan as conditioning regimen, but we do use more intense regimen for some of our high-risk patients. But we could not see any difference in outcomes between males or females, especially when we looked at median progression-free survival. And this was from different time periods, but overall, a little over 3 years was the median progression-free survival for both 40 and 41 months. One thing that we saw in a subset analysis, and we do not know what to make of it, was that younger females, younger than 50 in the data set, had somewhat shorter median progression-free survival. That was 36 months compared to the matched younger male, which was closer to 5 years. So again, when we looked at that subset, there was not much difference in their characteristics, or it's not that female patients had more high-risk chromosomal abnormalities, or they got suboptimal treatment, and they all had transplants, and most of them received maintenance. So we could not tell, of course, because it's a retrospective analysis, but it's a good hypothesis generating finding. And we and others can look in the future that, is that true? Do others also see younger females, especially younger than 50, have done worse when it comes to myeloma? And if that is the case, are there some endocrine factors that may lead to that? So that was one little finding. But again, it's a subset of a retrospective analysis, so I won't put too much emphasis on that, but it's an interesting finding and maybe hypothesis generating, especially if it can be reproduced in other databases.